was the director of Child Study Center in Yale, and was too the leader of international activities of child psychiatry, was president of YACAP, and president of many international organizations. And the fact that we recognize to Donald this opportunity is because a very important part of this Congress was connected with his thinking, his ideas, and the people that work with him. One of the persons that was more connected, particularly in the area of research, with Donald was and is Jim Leckman. And tonight, Jim will present one topic that will be very fascinating for all of us: primary parental preoccupation, the continuing impact of Donald Cohen from generation to generation. Jim Leckman is professor in Yale. He is director of many projects in research, and as you know, is one of the most important research in the area of Gilles de la Tourette, but in general, in all the area of neurobiological research. It's two parts of important project that we shared together for many years about the EDICE group, the group that is connected with the Israeli-Palestinian conflict, and is a special researcher that starting from an important field of research, biological research, he was more and more interested to integrate biological knowledge in social science and in all the effect that the community problem can affect the biological part of the life of children and adolescents. It's for me an honor to introduce to you Jim Leckman.
So I know the program says I'm going to be talking about Tourette syndrome, so if any of you are here to really hear about the latest in Tourette syndrome, you can excuse yourselves, and there is a symposium that Flora Vaccarino has organized for Tuesday that I would highly recommend, and I will be talking at that time about some of our work with regard to some of the new findings with regard to neural oscillations in Tourette's, and also some of the recent genetic findings, because our colleague Matthew State isn't able to join us. But as I thought about Donald and about what I would say today, I thought about this area of work. And I think it also has to do with the fact that we're fresh from this Congress with the ERICHE group that has been meeting focused on the Israeli-Palestinian conflict, and I see this area of work as being closely related, and actually some of my colleagues that are involved that I first met through Donald are essentially co-authors of some of the work that I'll be presenting this evening. It's been a long day, and I'm so impressed with this Congress. Well done, Ernesto. So far, I think it's the very first one that I've been to where we saw a ballerina performing at the opening session, and I've known Dr. Cavalli Forza mostly through the Kenneth and Judy Kidd at Yale for years, and it's such a pleasure to hear him talk, and I'll actually be echoing a little bit of what he said about the role of evolution, the importance of genes, but also the importance of the environment and the fascinating data that's emerging with regard to the importance of epigenetic factors during critical periods of development. And these are all themes that I'm sure Donald would deeply resonate with. And I'll tell you a few stories about Donald along the way. For me, apart from the fact that he lives on in me in some small way, is the kind of legacy that reflects his values. And for me, although clinical research and research in general, neurobiological research, is important, providing care to families, having a real connection to those families, and making a difference in their lives if it's possible, should be the foundation of all of our efforts, whether it's in research or advocacy. That's why we're here. That's what's important. That's what we should focus on. When I say advocacy, I think of his involvement with some of the groups involved with autism, with Tourette syndrome. But I also think about his ability to bring people together, to advocate for our field, the multidisciplinary, bridging the gaps between our disciplines, bringing people together, convening them, and moving our field forward. This is what we urgently need. This is what we really are in need of. We see evidence of his mentorship and teaching. I think if you haven't met the Donald Cohen Fellows and the work of Andres Martin and Joaquim Fuentes, I would recommend that you do. I think it's a wonderful example of how Donald can live on in settings like this, in activities of that sort. One of my initial attractions to Donald, and I first met him over 30 years ago, was that he had an interest in philosophy and psychoanalysis. And when I was in university, I was a philosophy and chemistry major and naively imagined that somehow psychiatry was going to be the place where those two interests would meet. And I found a common spirit in Donald. Also, such a deep interest in language and his preoccupation with Winnicott and Rosenfeld and others was something that was a source of continuing dialogue for us and something that I admired about him, certainly a lot smarter than I was. The other piece was the science part, and for him it was not a problem. I mean, people are getting there today, but it was not a problem to be a psychoanalyst and to be an empirical scientist, to be somebody who cared about the early phases of brain development and finding ways of treating kids with somatic interventions, and still being a psychoanalyst and being sort of true to the complexity of that set of conceptualizations that we think of as psychoanalysis. And in some ways, my talk is looking at the interface between those two areas of interest. And I would also say that it was probably Donald that got me further along in my interest in psychoanalysis and my analytic training. And it's something that's been of great benefit to me, and I would also have to say to my family. Donald's best known for his work in autism and his work in Tourette syndrome and obsessive-compulsive disorder. But he was very interested in normal development. His whole book, two-volume issue that he's still a co-author of with Dante Cicchetti on developmental psychopathology, begins with a real exploration of normal development. And I first met Donald when I was at the NIH and traveling, but I think my first real encounter with him was when I was a resident in training at Yale, and he was teaching a course to the residents in general psychiatry about normal development. And what he would do is he would invite families in, and he began with a mother and a father who were about to become new parents, and to interview them in front of maybe 20 individuals who were residents in training. And he had this rare gift of being able to establish an intimacy almost immediately with the people that he was interviewing, despite the fact that there was a whole crowd of people. It wasn't as if we were behind some mirrors or something. We were all sitting right there. And in those moments, the place that person was in, beginning with a mother and father who were expecting their first child, to the next interview a week later where there was a new parent who had just given birth to their child, to the next interview where there was a new parent whose child was 3 months old, and so on through all of the stages of development, was a much more engaging, intense, and present depiction of what normal development was all about. And for my money, for our field, the more we know about how things unfold in a normal way, the range of typical parenting and the range of typical development for children, the better off our field will be. So let me tell you one other story that will begin what I have to say to you today from another perspective. I wasn't really terribly interested in Tourette syndrome or OCD. It was actually the work that I did with Donald and with the patients and families that really led to my really falling in love with the disorder and understanding it as best I can, although I must say the one thing I'm certain of is that we're still remarkably ignorant about these conditions. And our tools at the time in the 1980s were very crude. One of the tools that we had at our disposal was actually measuring levels of metabolites and precursors in cerebral spinal fluid. And I had begun a collaboration with Wayne Goodman over at the Connecticut Mental Health Center to collect CSF on a series of individuals with Tourette syndrome and OCD and normal controls, both mostly adults but children as well. And we had gone through all of that, and I see Jerry here. He's certainly involved in that initial set of CSF studies. We'd gone through all of the metabolites and precursors of the biogenic amines, and we still had some of this material left, and I didn't want to have it just stay in the freezer. So I started looking around for other molecules that we might take a look at, and certainly Donald was involved in these discussions. And the story, very briefly, and it's the story I'll mention in the talk for a few minutes, is that Marty Altimus had found that something called arginine vasopressin seemed to be elevated in some individuals with obsessive compulsive disorder. And it's a posterior pituitary neuropeptide, and I was fascinated by it because when I read more about it, I realized that it was sexually dimorphic, that outside of the central nervous system, it was much more present in males outside of the hypothalamus than in females. And I thought, oh, here's an answer. Maybe tic-related forms of OCD and Tourette syndrome would be characterized by high levels of arginine vasopressin. So I then went off to something called a Gordon conference up at Dartmouth, and had an opportunity to meet Bill North, who was one of the organizers, and talked him into measuring arginine vasopressin for us in our CSF. And during those conversations with Bill, he said, Jim, we're going to measure the vasopressin, we're going to measure the neurophysins that are the ones that sort of are the carrier molecules for this, but why don't we measure its sister neuropeptide as well, oxytocin? And one thing led to another, and we measured both vasopressin and oxytocin. And the interesting part of the story was that when actually even before we broke the blind, I got a call from Bill North saying, I don't know, Jim, who these people are. You didn't send me the code. We assayed the compounds blindly. But there's some individuals in this group that have extraordinarily high levels of oxytocin. We don't see any change in the vasopressin levels. So that was another beginning to this story, because I then read a lot about oxytocin and some of the work that had been done by Sue Carter and Tom Insel and others, and realized that this was an affiliative neuropeptide. This had something to do with close attachments, both pair bonding and sexual behavior, but also maternal behavior, at least in the animal studies that had been done. And there were these fascinating stories that were emerging about the montane voles and the prairie voles, and how one group was biparental in their behavior and the other group was not. And one thing led to another, and the question then became, well, what does oxytocin have to do, or affiliative behavior have to do with obsessive compulsive disorder? And that was a bit of a mystery, and I remember thinking about it, talking about it, presenting it at the Child Study Center, and then at some point I remembered that when we were expecting our first child out in San Francisco many years ago, I was preoccupied with things that might go wrong. Some form of, whenever my wife had a cough or a fever, I was terribly worried that there was going to be something wrong that would happen to the baby. I also saw this transformation in my wife, where she went from being a person who was relatively careless about the cleanliness of the apartment that we were in, the third floor walk-up that we were in, became meticulous about cleanliness and somehow having to have everything just right, and then all of the sort of nesting behaviors. And I found myself, even though I was a very busy intern, straight medical intern at the time, building a cradle on the floor of the kitchen in this very small apartment that we had in San Francisco. So I came across this idea that maybe there's something connected here, and maybe OCD is a dysregulation of a brain circuit that's normally involved in heightened sensitivity that surrounds the birth of new children or the formation of new relationships. And one of my favorite things to do at Yale, and Donald was a part of this too, was to teach a course with Linda Mays, who's been a close colleague of mine, on love and attachment. And it's wonderful to interact with the undergraduates at Yale. It's another wonderful opportunity. But is it possible that OCD is somehow related to affiliative behaviors in that way? And so we decided to study it. And actually it was Linda's idea after I made this presentation that let's go ahead and study it. She began her life as a pediatrician, although she's also a psychoanalyst and a neonatologist. And so we did the study. So let me come back to Donald for just a minute. This is a quote from what was called the Sterling Lecture, and he knew he was going to die within the year, most likely. And he was called upon, being honored by our university, to make some lecture. And he talked about his work in Tourette's, he talked about his work in autism. But this is a quote from Donald at that time. What fascinated me most was how intimate relationships and the desire for being with the others preceded the rest of cognitive development. And that the social motivation moves these other achievements forward, including meta-representations and theories about other minds. This intuitive, deeply encoded social orientation is first expressed in the mother's arms and then forms the basis for all future I-thou relationships. So there's something about the immediacy of that first encounter that we're going to be focusing on for the rest of the time that I have. And maybe I could ask, Bob has to leave a little early, so Flora, when I have about 5 minutes left, just wave your hand and I will. She doesn't have a watch, so somebody else is going to have to help her out. So we met at the Innocenti Center for or Institute for the last, for 3 days, beginning about 4 days ago, in this group of individuals who were trying to work together, are working together to make things a bit better for Palestinian and Israeli children. But on the third floor or the fourth floor of the Innocenti Center, there's a wonderful museum, and this is one of the Madonna portraits that's there. And what I'll be telling you about is what's on this woman's mind. And what I'll be telling you about is what are the changes that are happening in levels of gene expression in this boy. And how current advances in neuroscience are beginning to really help us understand in a deep way some very fundamental phenomenon that we all share. We all wouldn't be sitting here today unless somebody cared for us well enough for us to survive that period of high risk that is a part of infancy. So I do think that evolutionary accounts provide the best perspectives on psychopathology as well as normal behavior, and that the probable cascade of evolutionary events that's led to the emergence of our species and our repertoire of behaviors and mental capacities has also left us vulnerable to some forms of psychopathology. I don't have time to go into this in a great deal of detail. But basically what I'm going to be telling you, and maybe I'll just go back a couple of points and say, what is on this woman's mind is intrusive worries about harm coming to her baby, how she can make everything as perfect and right as possible. And one of the other things that we've been studying, and I see Bob King in the audience, he was very helpful. Ruth Feldman was also very helpful in this study. The other thing that she's perhaps not thinking about at this moment, but about how wonderful and perfect her baby is, and how that idealization, although that's a complex word, is something that may move forward that synchrony and attachment that is so important. So let's talk a little bit about parental behavior, maternal behavior, and here I will tip my hat to my psychoanalytic background and to Donald Winnicott, who was one of my favorite authors as I sat through my courses and was involved in my various discussions in that setting. And he said, I do not believe it's possible to understand the functioning of the mother at the very beginning of the infant's life without seeing that she must be able to reach this state of heightened sensitivity, almost an illness, and recover from it. And we wrote this up some years ago. There's a replication that's now been completed, and we're in the process of submitting it for publication. I'll also present to you some of the brain imaging data that's been collected that hasn't been published yet, that shortly will be appearing, I believe, in print. I'm hoping that the revision to our manuscript will be accepted. And another way of framing this is to say, let's take something like a rating scale for obsessive-compulsive disorder, like the Yale-Brown obsessive-compulsive disorder scale, and change the way in which we ask the questions, and ask these questions of new parents at the end of the pregnancy, at 8 months of gestation, a couple of weeks after birth, and at 3 months after birth. And we imagined that we might see a higher level of preoccupation in the moms than we would with the dads. And I guess another way of saying this is that we wanted to do an empirical study of Donald Winnicott's idea. Well, what really is the content of the preoccupations that he was talking about in those new parents? So we had 41 pairs of parents that we had complete data on for these 3 time points, a prospective longitudinal study. These were typically developing parents. What we found was that if you had a Likert scale going from 0 to 10, that if you ask them, and I think 10 was, I can't stop thinking about my baby. And 0 was, I never think about my baby. And I was impressed with how well the dads did on this particular scale. But the fascinating thing about this was that for some reason we wanted to have the ratings done, the self-report, and then we wanted to have the interviewer, because the interviews were done in the home, we wanted the interviewer to make a rating about how preoccupied you think the parent is. But then we had the parent make a rating of how preoccupied they saw their spouse as being. And unbelievably, in every one of the data points that we had, the spouse rated their partner as being more preoccupied than the partner had rated themselves to be. That even though there's probably a ceiling effect in terms of these data, we may not have captured the whole. And frequently people would say, well, maybe if I go 2 minutes, it's a long time without thinking about the baby during this particular period of time in development. So I'm going to go through these very quickly. Worries about one's own health would be not so uncommon in OCD. Interestingly, the dads were more worried about their health than the moms were, which is interesting. And even more interestingly, the mothers were also more worried about the father's health than the fathers were about the mother's health. So this may be something sexism, I'm not sure. You could also put some sort of just so evolutionary story on this finding. Whether it's true or not, I'm not sure. But this is what we found. Anxious thoughts about things not being just right, worries about the physical environment and safety of the baby, worrying about something bad happening, the baby falling downstairs, tripping, falling off the changing table, all sorts of things. But also worries about bad things happening to the baby. This was one that we had to think a lot about in terms of how we would phrase the question, and if we would even ask the question, thoughts about doing harm to the baby. And you can see more than 30% of mothers and fathers reported that. A number of them said no, but I could understand how someone might feel that way. And usually the story I tell here, and my wife isn't in the audience, so I feel free to do it, is that when she brought Emily back from the hospital, newborn, we were living on this third floor walk-up in San Francisco, and if you went out on the fire escape, which is this sort of rickety wooden thing, you could see one of the towers of the Golden Gate Bridge. And she took Emily out there to show her the Golden Gate Bridge, and when she went out there, she had this thought of throwing her off the balcony. And she did not go out there with Emily again, period. We left San Francisco about 7 months later. Now you could say, well, maybe she's an evil woman and she has bad thoughts. But that is probably not the case, and it's probably more that there was a warning that was offered to her. It's also interesting, as I reflect on my experience at Yale, my very first inpatient that I was asked to see and care for was a woman who had a form of depression that was chronic. And when I went in to see her and I asked her about what was going on, she told me this story about the fact that she was immediately in the postpartum period and had these thoughts about putting her fingers in the baby's fontanelle or putting the baby in the oven. And she became so distressed by her thoughts about that she stopped taking care of the baby and gave the responsibility to others. And this is sort of a postpartum OCD that you can see not so, somewhat uncommonly, and ended up becoming severely depressed. Anyway, a good number of people admitted to these feelings and thoughts. So if it's OCD, then maybe there's a compulsive behavior that's associated with it as well. And I'm not sure if you can remember back, and there may be some new parents in the audience, but have you ever checked on your baby even though you know your baby's okay? The kinds of things that we have out there to monitor babies and so forth, it's there, and most everybody said yes to this question. And then we also asked the question, well, what would happen if you were prevented from checking on your baby? And of course, that drew some very strong responses as well. The most favorite part of that interview for the families, and as I heard them secondhand from the interviewers, was the question about, have you ever thought of your baby as being perfect? And what I usually say at this point in the talk is that the parent would sort of look one way and then another and then say, well, but it's not because she's my daughter. And it's interesting. Anyway, so this is my daughter Emily, and this is my grandson Caleb, and this is shortly after his birth, about 20 months ago. And she's right out of the book. It's amazing to see your daughter turn into a new mother, but her need for things to be clean and just right, her preoccupation about everything having to be, I can still remember being told how to clean the house before we left. This was about 2 weeks after the delivery. So there it is. Those are the people I'm talking about. This is the replication study. This is the same finding about preoccupation. We have a construct that puts a lot of those things together called anxious, intrusive thoughts and harm-avoidant behaviors, which is sort of our OCD construct, and you can see it declines from week 2 to 3 months. Idealization, we spent more time focusing on that, the most beautiful, perfect child, love without limits. We did word counts. Amazingly, this increases with time for typically developing parents, that the baby becomes more perfect. This is a fancy word, I apologize. I call it hedonic transformation, but it's a changing of how what you value in the world is transformed by the birth of the child, especially your first child. And I have such a vivid memory of this in my own experience, of how my life was transformed by the birth of our first child. And that also changes over time in a positive direction. And there's not time to go through all of these slides. The people who funded this replication study was a group called the Institute for Research on Unlimited Love. So we certainly wanted to ask some questions about unlimited love, and here were some of the answers. I'm amazed at how much I love him. I guess it's how to describe true love. I would do absolutely anything for her. And this one is my favorite. It's about your purpose in life, something mysterious about how your sense of who you are is deepened and clarified by having a baby. So here's another one. I think there may be some idealization here. And we could go through the conserved mental states and conserved behaviors. There's not really time. There may be a way of getting a hold of this talk. And it may make sense from an evolutionary perspective. The reason our mortality figures and our life expectancy is so long these days is because infant mortality, at least in developed countries, has been reasonably effectively addressed. It's only been in the past century that infant mortality rates, even in Western Europe, have fallen from over 100 per thousand lives births in 1900 to just 10 per thousand in 2003. So what I'm going to do now is take you on a journey. I'm going to go a little faster than I would like to, but it's a long day. We're all a little tired. Thank you for coming, but I'm going to move through this pretty quickly. The neuroscientists have been studying maternal behavior for a while. These are some of the features of it. Some of my favorites are licking and grooming, and I'll come back to that when I talk about Michael Meany's work. There's some things that we don't do. As far as I know, placentaphagia is not part of our repertoire, but the rest of them, probably there. There's a time course that's associated with it. There's also, so here's my Madonna picture for the rodent lovers in the room. There's also something called sensitization that became important when we were looking at the genes that are involved in maternal behavior, because some of the genes leave you unable to reproduce. And so a phenomenon called sensitization is something that was described by Rosenblatt and others, and it has to do with if you put a newborn animal in with a juvenile conspecific, either a male or a female, over some period of time they'll start beginning to develop maternal behaviors, retrieval, nest building, keeping the pup warm. And you can see the latency is a lot longer for those juvenile conspecifics, the virgins in this depiction versus the ones who had just given birth and had just weaned their own pups. So neurobiological circuits, this has mostly been done in, so actually oxytocin, for example, is made just in these two structures, the supraoptic nucleus and the paraventricular nucleus. It's released down here in terms of the circulation, but it also is projected all over the place from the parvocellular elements here in the PVN, all over the nervous system. People have done studies, for example, medical students reaching a sexual climax. You can just see these guys in the laboratory. There's a high level of oxytocin released at that moment. Fortunately, the next study they did was with cervical stimulation during sexual activity in sheep, fortunately. And you can see with cervical stimulation high levels of oxytocin being released. Anyway, it's all coming from this place and that place. And one could argue, and what people have done, let me just go on to this other study here. Maybe it's not there. I must have taken it out. Sorry about that. There's a circuitry that's so important in this, and the circuitry actually is so interesting, and I talked about it in the ERCHE meeting earlier today, that our affiliation system and our stress response system are sort of right next to one another and immediately adjacent, because this is also the home for the CRF containing neurons that project down to the anterior pituitary down here. So you could say, what relevance does this have to human studies? Those are rats, those are mice. What about us? And so we've just recently finished a study of 24 mothers, 20 fathers, at 2 time points, 2 weeks and 3 months, and also 20 non-parents. And James Swain, a Canadian, has been the first author and primary investigator in this work. And basically there were 2 sets of stimuli, auditory stimuli, so you could listen to your own baby cry that you recorded during a diaper change. Or you could listen to another baby cry that was not your baby cry. And interestingly, about 80% of these parents could say, oh, that's my baby cry, and be right. So it was better than chance by a long shot. And the control noise was something like this, that had a similar kind of auditory signal but was different. We also had them take pictures of their baby, and we would show them pictures of their own baby. If we go back to the design of the study, own baby, other baby. We also had own toys, houses, other kind of control stimuli as well. So here are some pictures of the babies. Here's a picture of Caleb again. I guess I'm a proud grandparent. And then there are some of the pictures that, there he is, and that's a perfect, beautiful baby in the eyes of those parents. I hope the parents aren't in the room. I apologize if they are. So this is the first time I presented this. It turns out that parents are different than non-parents. So if you look at the 20 non-parents compared to the 40-some parents that we had, and interestingly, most of the differences, at least at time 1, 2 weeks after delivery, are in the cortical areas. And we could go through these cortical areas. Supplementary motor area is an area that it gets activated just before you do something. There's an intentionality, oh, I need to do it now. And so you could imagine that a new parent would have a feeling like, oh, I need to do it now. Check on the baby, etc. And it changes with time. So just remember, parents are different than non-parents in terms of brain activations that you see. If you do within the parent group and compare time 1 to time 2, you can see that there's a very similar patterns of activity. And I'm not going to take the time to go through this in a great deal of detail. And the same is true when you do the own baby cry to own baby control noise. Similar set of patterns emerge. But what we were most interested in was own baby versus other baby. And believe it or not, some of the areas that are involved are just the same ones that have been implicated in obsessive compulsive disorder. Things like the orbital frontal cortex that you can see here, the amygdala, and some of the areas that are involved in sort of stress response. But in addition, there are these areas of the brain that are involved in reward pathways, substantia nigra, ventral tegmental area, areas like that, as well as the hypothalamus, which is an area of the brain that is crucially involved in maternal behavior that we were talking about earlier. I'm going backwards, sorry about that. So the take-home response to their own infant cries, parents show increased activation of hypothalamic and midbrain sites. That's the dopaminergic sites I was mentioning, as well as orbital frontal, cingulate amygdala, as well as some of the areas involved in habit formation, putamen, globus pallidus, thalamus, among others. Interestingly, for some of these findings in the insula and the orbital frontal cortex, there was a correlation between that construct that we had of anxious intrusive thoughts and harm avoidant behaviors in both mothers and fathers with the level of activation that we saw in that in the own cry versus other cry comparison that we were doing. So the take-home message here is at least some of the brain circuits aren't that different than what we saw in the animal studies. And here's the diagram I was fantasizing that I told you about. So here, all of this is part of the hypothalamus right here. Here is it's coated in yellow because if you destroy it in animals, you see a loss of maternal behavior. And so I sort of see this as sort of and this is sort of the reward pathways that I was talking about. Here's the amygdala over here. Here's the orbital frontal cortex. So the same circuits are basically the same ones that are involved. And reward and salience pathways, perceptual stress response systems. We have a lot of work to do still. We're most interested in looking at high-risk families, particularly ones involved in perinatal depression, cocaine use during pregnancy. And we also want to look at first-time versus veteran parents, traditional versus non-parental roles. We've taken a brief look at that, and it does turn out that the amount of physical contact that the parent has with the child, so if a non-traditional role that the father's doing a lot of time with the child in direct physical contact, you see differences in terms of the activation patterns. We also need to look at the picture data in more detail. Let's go to genetic factors. There are at least 12 genes that if you knock them out, you see a loss of some aspect of maternal behavior. There are a range of transcription factors, enzymes, receptors, transporters, neuropeptides. I did a review of this with one of the medical students at Yale, Amy Herman, a few years ago. Interestingly, 2 of these genes, PEG3 and MEST, are paternally imprinted genes, which means that they're only expressed, the only thing that's expressed in the maternal, in the mother, is the gene she got from her father. So that's PEG3, that's actually paternally expressed gene number 3 is what that means. And I'm just going to give you an illustration of a couple of these. But what we did was we looked for a way in which these genes might be related to one another. And interestingly, we've been screening these genes in autism now because some of the intimate behaviors that are seen as a precursor, we've had some thought that there might be some abnormality in these genes in autism. And I was just looking at the data before I came, and there's some suggestion, particularly for FOSB, there's a very robust connection in terms of the association studies we've been doing, but that's another talk. Anyway, we looked at the various behaviors, we looked at the various genes, and we came up with these cladistic relationships relating the genes and relating the behaviors. PEG3, there's really not time to go through this, but basically if you look at the knockout versus the wild type, there are many fewer oxytocin neurons in that structure that I was telling you about, the paraventricular nucleus. Another favorite of mine is DBH, dopamine beta hydroxylase. This is the gene that's involved, the protein that's encoded by this gene is involved in the transformation of dopamine to norepinephrine and epinephrine. And interestingly, what's lost when you lose DBH, when you don't have any DBH at all, is these mothers just walk right by their pups. They don't retrieve them, they don't care for them, they just walk right by them. But this is something that can be completely reversed by adding a precursor of norepinephrine just before the delivery or doses before and after the delivery. So far, to my knowledge, and this is actually an Italian study that was done, there's only one gene that seems to be limiting pup responsiveness that's been identified so far, and this is the mu receptor opioid gene. And they did other controls that aren't shown here, where if you took a knockout mouse that didn't have the mu opioid receptor and you put them in a cold environment, they had a lot of ultrasonic vocalizations. That's what the UV means, ultrasonic vocalizations, which is a level of distress for the pup. But here, mother present, mother removed, the wild types show a huge, they're just screaming in terms of their ultrasonic vocalizations, but in the absence of that mu opioid receptor, you can see in terms of when the mother is removed, there's hardly any difference. See if I can find my little pointer here. There's hardly any difference whether the mother's presence or removed with regard to what you see in those knockout animals. So I'm sure we're not finding all the genes, there are other genes, but it's pretty hard to avoid finding these genes because if you're looking to reproduce those animals and you have a deficit in maternal behavior, it shows up. And so you have to deal with it even if you're not interested in maternal behavior. Environmental influences, and here we come to some of the work of Michael Meany. And here's a good example. I think this person deserves a Nobel Prize. I really admire his work tremendously and have for the last decade. And basically, it's looking at rats, Norwegian rats. I know there are a lot of Norwegians in the conference, some of my friends. And it turns out that at least for the Norwegian rats, some of them are high lickers and groomers and some of them are low lickers and groomers. So if you take the two ends of the distribution, and there are some that lick and groom a lot and some that don't lick and groom that much. And interestingly, if you look at the offspring of the high lickers and groomers, they become high lickers and groomers when they grow up. And if you look at the offspring of the low lickers and groomers, they're low lickers and groomers when their turn comes to be new mothers in the next generation. So Darlene Francis, who was working with Michael Meany at the time, a fascinating woman, did this wonderful study that was published in Science almost a decade ago now, where she did the classical experiment, where she basically took some undisturbed litters, some litters, maybe I should back up and tell you the story actually. Others where she basically, took the high lickers and groomers and basically took 2 out of one litter and put it into another high licking and grooming litter of a mother who was a high licker and groomer. And then she also took 2 out and put them right back in again, so there was a handling control. And then the experimental condition was this last one, where she took a high licking and grooming 2 animals, pups from that group, and put them into a low licking and grooming litter. And then she did exactly the same thing with the low lickers and groomers. And what she found was that if you were raised by a high licker and groomer, so here's in your own litter, here's where there was just a handling control, here's where you were put into a litter of another high licking and grooming mother, you had a high licker and grooming outcome. And indeed, if you were born to a low licker and groomer and you were raised by a high licker and groomer, you became a high licker and groomer when your turn came. So here's the experimental condition, and the same is true if you were raised by a low licker and groomer, and here you were born to a high licker and groomer but raised by a low licker and groomer. Basically, when your turn came to be a new mother, you were a low licker and groomer. So it sounds like it's all to do with nurture, not nature, in this circumstance. And that's true for exploratory behavior, and interestingly also in terms of stress response. There are big differences. The animals that were raised by high lickers and groomers are more willing to explore new spaces, and they have a lower level of stress response. And I think the reason he deserves a Nobel Prize is they've begun to figure it out, and it actually has to do with epigenetic decoration and modification of genes. And there are 2 genes so far that they've described, and I'm sure if it's true of 2 genes, it's going to be true of probably 20 or 30, and it may not be true just of genes that are involved in maternal behavior. But here's one, or stress response. So here's one with regard to trying to understand stress response. So if you remember, there was a difference in stress response depending on whether you were raised by a high licker and groomer or a low licker and groomer. And basically what they found, and here I'll just focus on this, if you look in the hippocampus, which is sort of the high end of that stress response circuit, and you look at the pattern of methylation in a promoter region of the glucocorticoid receptor gene in the hippocampus, you find the following. That basically, maybe if I do it like this it'll be easier. Basically, at the end of gestation, nothing is methylated. 1 day after birth, everything is methylated at this little region. And then if you were raised by a low licker and groomer, you remain, the methylation decoration remains. And if you were raised by a high licker and groomer, it disappears again. And it's a highly significant difference. And it looks like there's an epigenetic modification so that there's a change in the level of gene expression as a result of this decoration on the promoter region of the gene. So despite genetic constraints, the nature of early caregiving experiences have enduring consequences on individual differences in subsequent maternal behavior, anxiety regulation, patterns of stress response. They've also found this in another hypothalamic region, the medial preoptic area, which is very important. If you destroy that, which the classical studies in neuroscience had done, you also see a loss of maternal behavior that's pretty profound. And interestingly, there's a change in epigenetic modification in the estrogen receptor alpha gene, which is another gene that if you knock it out entirely, you see a loss of how am I doing on time? 5 minutes, thank you. Okay, so let's just keep on going. One of my other people that I'm deeply in love with is David Oles, and he's been doing this study where he has early intervention studies, and basically the study is where let's see if I can, here's the outline for it. They start actually before birth. Well, I'm not getting it correct. Anyway, they intervene as soon as the high-risk mother knows that she's pregnant, and they follow the child with a nurse home visitor in the home for the first 2 years of life. There are lots of home visiting programs. This is probably the one that's the best developed. They have a variety of goals, including pregnancy outcomes, improve child health and development, improve parents' economic self-sufficiency and human capital. And what's remarkable is they did randomized studies. And I'll just very quickly go through they did it in Elmira, New York with 400 families, random assignments. So they either got this intervention or they got money to go to their pediatrician. They did it again in Memphis. They did it again in Denver, Colorado. And they have consistent results with regard to positive outcomes, with regard to improvements in women's perinatal health, reductions in childhood injuries, fewer subsequent pregnancies, increases in employment, reductions in state assistance, improvement in school readiness, marked reduction in externalizing behavior. In some ways, the most impressive results are with regard to externalizing behavior. The kids are less subjected to abuse and neglect. And when they grow up, and they did a 15-year follow-up, and the data for the 20-year follow-up is coming along now, markedly reduced rates of arrests. Interestingly, if you look at the neurological outcomes and their developmental outcomes, both language and mental development, you see a much better performance with regard to the nurse home visited families than with the other groups. I'm going the wrong way. And it also turns out to be very cost effective when independent evaluations have been done of this evaluation. So every dollar you spend, you actually save $3. And what's remarkable is that this is just looking at the data from 15-year follow-ups, but if it's true, and one of the subtitles for this talk is From Generation to Generation, is that you may be making a difference in these families, not only in this generation for this high-risk pregnancy and for this mother and child, but when that child comes of age to be a parent, there may be a difference as well. And they didn't look at maternal preoccupation. What they usually talk about is the fact that there's a bigger difference in terms of how long the mothers waited before their next pregnancy. And here you can see it's over 5 years in the experimental group versus something around 36 months for the mothers in the control group. And again, the long-term impact of these early intervention programs may have an enduring effect and may affect the next generation. And this is one of Donald's favorites. And actually, the annual review issue of the Child Psychology and Psychiatry Journal that I edit, if you are interested in looking at any of these questions in more detail, there are a wonderful set of reviews that were published in the March-April issue. Ruth has a wonderful article on synchrony. James Swain has a review with regard to neuroimaging. But Peter Fonagy, a number of other people also have wonderful, and Michael Meany has a paper there reviewing some of the epigenetic findings that I was talking about earlier. So to come back to Winnicott and to come to some conclusion, and I apologize for coming very close to the end of my time, good enough genes combined with a good enough maternal care are needed to ensure positive outcomes in childhood and beyond, and such interventions may have consequences for generations. Certainly our capacity to do these studies is remarkable, and I think that this integration, and actually Flora Vaccarino had a wonderful talk this morning for those of you who were there, trying to do this kind of integration for our entire field, because I think that the opportunity is there to do it. And we're just beginning, and Ruth is, I think, at the lead of this in terms of some of the imaging studies, being able to also look at issues of synchrony, measuring at the same time some of the electrical activity that's seen in mothers and child during these periods. I think there's a real opportunity for that kind of work. And I guess what I would say is that all of these things, whether it's the OCD-like behavior, the preoccupation, the idealizing thoughts, the care constructs that we've been looking at, all reflect some change and increase in maternal investment, parental investment, that can make a real difference, probably at a biological level, that can have enduring consequences for generations, as well as just in terms of the behavior of the parent. So I mentioned Linda's name and Ruth. There are a number of other people who've been very involved with this. In terms of the genetic studies, I mentioned Amy Herman and Elena Grigorienko is the person who we've been doing the work with autism, looking at some of these same genes. James Swain has been involved. Flora's also played a role in some of the work, and R.A. Kaufman in some of the work that we've been doing on the neurobiological piece. So let me end with this quote, I guess what I would add to this quote is that the desire to be with the other that precedes cognitive development, I think it probably matters not just the desire to being with the other, but there's something about the way that you are held and touched and regarded and idealized and supported that is also the ingredients for where you're going in terms of all future I-thou relationships. It matters. It matters. It matters. And if we can do a better job with high-risk populations, it matters in terms of having better outcomes. And it's something that I think our field should focus more of its attention on in terms of finding ways to prevent some of these outcomes rather than simply dealing with them once they have come to our attention in our clinical consultation rooms. So thank you, Donald. And I think that this presentation would be very consistent with your perspectives, your views, and who you are. So thank you all very much for your attention, and have a good evening.